Hi there, Andrew with Zang Physical Therapy here, and today I want to talk about the benefit of attention in healthcare. So, if you are somebody who has been to a physician, a doctor's offices, specialists, physical therapists, etc., in the last few weeks or months, how did you feel about the level of attention you were seeking? Or if you are somebody who feels you needs medical care but are avoiding entering the healthcare system because the attention that you're going to get is subpar or unsatisfactory to your liking. So if that's you, then this is exactly what I'm going to talk about. So when medicine began years and years ago, it was all one-on-one. It was apprentice-based learning. You had a provider. The medical man, he would go to your house, or you may come to his office. It was all individualized appointments. You knew his name. You saw him around town. You ate with him. You did all these things. Let's fast forward several hundred years. Now they don't or rarely ever come to your house. You have trouble getting a hold of them. You're on hold calling the doctor's office for 20 minutes, 30 minutes, pushing buttons, asking language questions and just waiting. Maybe you get to speak to the person you want to, and then just maybe you can get a reasonable appointment time for yourself. Then you show up for your appointment and you're sitting in a waiting room and waiting and waiting and waiting. Your appointment time was 25 minutes ago and you're nowhere near being seen. By the time you're seen, it's been an hour after your appointment time, and you're frustrated, and you really don't like the whole process, and so you don't want to go back to see that doctor or any provider because you're just so dissatisfied with the level of service that you get. Because when you did see the provider, it was for 3, maybe 5 minutes. In the medical world, in the physical therapy world, that first appointment, yeah, that might be 40 to 60 minutes. After that, how much time are you getting with your provider? 15 minutes? Less? Hopefully not. How is your problem going to be solved if the person best suited to help you sees you for 5 or 10 minutes or 15 minutes tops and then punch you to somebody with a lesser degree to then manage everything? It's just not feasible. And that's why people become so disillusioned with healthcare in general and physical therapy. And we do it to ourselves, and that's on us, and we need to take ownership, which is why I'm on here today to talk about the benefit. So when you do get the time and attention you need, you're going to get your questions answered. You come to an appointment, you probably have a mental list of questions, and you feel so rushed that you forget them all, right? How about you write them down? If you write them down, you can pull it out of your purse, out of your wallet, or your pocket. You can look there, and you can hold the provider and make them answer each and every question. For most providers, they're not going to have the time, and they're going to be very short with you and run out the door. But if you have a provider who's going to give you that one-on-one attention, they'll sit there for as long as it takes and answers your question. Maybe your appointment time's over and they're still answering your questions, but they're not rushing you out the door. They're willing to get on the phone with you if you realize you have a question on Saturday. They'll respond to your emails. How many doctors, how many providers really do that? But if you have a healthcare provider who says that they provide true attention like this, why don't you want to meet that person where they are, right? If I had an issue, I'm looking for a provider who's going to answer my questions, who isn't going to try to get out of the door. Even if they try to, I'm not going to let them because I'm a stubborn jerk that way if I actually have to go to a doctor, which isn't that frequent. But when I do, you're not leaving until you answer my questions, period. My time is valuable, and you're going to honor my time, not waste my 2 hours of time sitting in a waiting room and then another hour in your room waiting for you to stumble in for 5 minutes. So demand that of your providers. And if they're not providing that level of service, then it's probably time to go find a different provider. What else are you going to get with a higher level of attention? You're going to get your problems solved faster, right? So if you add up all the times that you saw your doctor or your therapist or whatever health professional was helping you, how long did it take them to finally reach, or how many times you have to go before you finally reach something that you deem satisfactory, right? So if you're seeing, say, a physical therapist and you get 15 minutes of their time and you're going 2 or 3 times a week, so you had 30 to 45 minutes of the actual PT's time, and you spent probably 3.5 hours of your week driving there with other support personnel driving home, versus somebody who's going to give you 45 or 60 minutes just once a week. So you get the same amount of service one time a week, and boom, you have all your questions answered. You know exactly what to do. You have your plan, and now you have an extra 2 or 3 hours in a week to go do other things. So attention is all about, time and value is what it really comes down to. How much do you value your time? How important is that to you? And if your time is important, then you need that strict one-on-one attention. And it is out there. And I'm looking to bring this model back to as many people in my area as possible. And there are hundreds of other people just like me all throughout the country. If you're watching and you don't live in my area, that's fine. You can find somebody in your area who will do this. But when you do call any of these provider places, ask the tough questions. How much time am I going to spend with my primary provider? Are there going to be support providers helping me along the way? And if you are, and you're looking for that highest level of care, then that may not be the best place for you to recover the fastest. Maybe if you just had a small knee surgery or you had a shoulder surgery, maybe that works for you. But for the majority of people who have complex problems, getting passed around does not lead to getting the answers you seek and getting and recovering as fast as possible. So if you are interested in continuing this conversation on the benefit of attention healthcare, please let's continue the conversation. Something I'm very passionate about. I want all the clients I see to be satisfied with the level of care they receive, and be blown away that this is what they can get out there. And they don't have to be relegated to substandard care, because you just shouldn't have to anymore in this day and age. There's plenty of people willing to provide it. So again, if you have questions, post them here. I can get back on later this week and I'll talk more about it. Send me an email. Again, this is a very important topic for each and every person who has an issue that they want to be addressed. Okay, so I hope you found this helpful. And if you have questions, email me or anything along those lines. I'm more than happy to talk and communicate as long as necessary, so that, again, all the people out there can get the level of attention that they do deserve and do want, and get back to their activities as fast as possible. All right, have a nice day.